1 week from today, the next big group could become eligible for a vaccine here in Wisconsin. That includes teachers, child care workers first, and then some public-facing essential workers like bus drivers and grocery store workers.
But there are still a lot of people who are currently eligible who have not received their shot yet. Amanda Quintana is live at UW Health with more on where we are in vaccinating those groups. Amanda?
Yes, well, we've asked DHS over the last few weeks, and they have said that it does look like March 1st is going to be the date that the rest of the people in Group 1B become eligible. That's 600,000 people approximated. Now, I have talked to some pharmacists over the last few days, and a lot of them haven't gotten any vaccine, and they still have people in Group 1A that they need to get to before they can even start Group 1B.
The challenge that it creates is their expectations.
That expectation is that when teachers, bus drivers, farm workers, and the other hundreds of thousands of people left in Group 1B become eligible next Monday, there will be a vaccine for them. But it's just not that simple.
Eligibility doesn't necessarily mean that we have the vaccine and the appointments when we have previously eligible individuals still to vaccinate.
UW Health hasn't gotten through half of its 65 and older patients yet. And when you take a look at the statewide data, Wisconsin hasn't gotten through half of that group either. It's hard to tell how many of the 800,000 people who have received a dose are frontline healthcare workers, police and fire, or 65 and older, because people's jobs or eligibility groups aren't listed in the data. But we know that adding up DHS's estimated population of each of these groups, that's almost 1,300,000 people that are eligible right now. That means almost 500,000 people currently eligible haven't gotten a shot yet. Even though 600,000 more people might become eligible on Monday, that doesn't mean vaccine is available for them on Monday.
You have more people that you're adding into the queue. It leads to longer delays as far as the timing, depending upon supply, and it leads to a little bit more competition, I guess, as individuals are looking to get on those lists.
Dr. Matt Anderson at UW Health says that smaller pharmacies, that just means more people vying for the same amount of appointment spots, a process that's already flooded with people and can be confusing. With a supply chain that just isn't enough to move through these appointments quickly.
When the next groups come and UW Health starts opening scheduled invitation appointments for other groups, it's going to be on the back end of the people who are already scheduled. So that's going to be at a future date.
If you're 65 and older and you have an appointment with UW Health to get your vaccine still, they say that you will be prioritized before anyone that is newly eligible. So if your appointment is rescheduled, if it's pushed back, that's because there's a lack of supply. That doesn't mean that somebody who's newly eligible is going before you.
Amanda